Hello, everyone out there. We're going to be starting in just 1 minute. Thank you for logging on to the Lead Homelessness, How to Create Resources to End Homelessness webinar for Continuums of Care. We have lots and lots of cities logging on right now, so we're going to give them about 60 seconds to do so. Just a reminder, again, the webinar will start at 1 p.m. A reminder that you are able to submit questions in the GoToMeeting text box, and you're also able to email questions. You can text questions in as well, 407-456-0605. We have a text number that you can use, but we're going to be starting in about 60 seconds, the webinar. So thanks for logging on promptly at 1 p.m., 10 a.m. Pacific time. Good. Again, thank you to everyone who's logging in right now to our webinar on how continuums of care can maximize resources to end homelessness. We have about 130 COCs from around America represented. We're excited to chat with you for the next hour. That's me. Again, if you have questions right now, even before the webinar starts, we're going to start in about 30 seconds. You can put those questions in the GoToWebinar box, and we're going to try to get to as many questions as possible, or you could send them to us. Again, we're going to start in about 30 seconds. So get all snuggled up in front of your computers, wherever you are. Some of you it's earlier in the morning, some of you it's after lunch. Again, exciting that we have over 140 now continuums of care around America on this webinar, and we're going to start in just a few seconds. Excited to talk to all of you out there about how a continuum of care can really address the issue of resources. And all right.
Can you go back to the address, the email address?
Let me give you the email address again, info@leadhomelessness.org. And if you have a question, you can put it in the chat box. So welcome to all of you who are attending our webinar today. This, again, is an exclusive webinar for Continuums of Care brought to you by Lead Homelessness. That's an organization that I founded years ago that helps work with communities on the issue of homelessness. My name is Andre Bailey. Put me in Google if you're bored. I kind of have a unique spelled first name. So if you're bored in front of your computer later today or even during the webinar, you can Google me and you'll see a lot of the work I've been able to do on homelessness over the past a few years. I was the director of homelessness for the city of Orlando, for the Central Florida region, and had some great opportunities to work on this issue around America with, really interestingly enough, continuums of care, mayors, philanthropic partners, etc., looking at how do we work on the issue of homelessness in 2019. This is me. Again, if you have questions, feel free to put them in the GoToWebinar control panel or email us directly. So here's what we're going to talk about today. We're going to take 1 hour. Some of you are on your lunch. Some of you are carving out an hour. So I want to be sensitive to your time. We're not going to go longer than an hour. We want to talk today about resources, money. Continuums of care have the challenge of ending homelessness, I'll use that terminology, helping as many folks who are homeless as possible in your community, transforming lives, etc. You have that job. If you're the CEO of a continuum of care, if you're on the board of a continuum of care, if you work for a continuum of care, it's your job to come up with the plan and figure out how to run the coordinated system and make it all happen. So we want to talk again on how you do that from a resource standpoint, money standpoint. We want to talk today about maximizing state and national resources creating what we call bridge funding to advance homeless initiatives in your community, how to use the economic impact to drive fiscal policies. What I did there, and this is very important if you guys are working, if you're in front of a computer with some of your staff, I just made a divergent point there where I went down the road more of local money and philanthropic money. I'm saying, if you're going to change policy, it's going to be local, philanthropic in nature, where these might be maximizing current resources through like your NOFA allocation. So we're going to talk about how to get more money from your local community, and I believe there's a clear methodology on how to do that, and to partner with what we'll call impacted systems. Many of you are doing this. We've talked to many of you about this already. There's unique partners in your community, especially hospitals, behavioral health, law enforcement, and others who are on the front lines helping those who are homeless, just like you are, but there's not always a connection. So how do we use that connection to then get you more resources to do your job? So let's dive right in. How can a COC maximize state and national resources? I want to start, I don't want to overwhelm you with data, but I want to start by looking at the HUD homelessness budget. We're going to send you all these slides, so don't necessarily worry about it. And we're not going to put them up because GoToMeeting, if you put the slides up in front of you, it dominates and you can't see it right. So we don't want to put these slides up. We want to send them to them later, or we want to make sure that we're adjusting it properly. So I'm not going to put these up, but what these are, and we'll go ahead and send these to you immediately following the webinar. We might even be sending them to you right now. This is the HUD budget comparison for the funding for the McKinney-Vento Homeless Assistance Act, HUD VASH, et cetera, et cetera. We've also included up here the Department of VA's homeless funding. The reason this is so important, I'll go through these numbers in just a second, is because I want to make a very practical point to you. We have a chart here that breaks this down in a little bit more of a simplistic way. But coming back, and many of you know this already, but for those of you that don't, this will be helpful information if you're just starting in a continuum of care space. But if you're someone who's like, Andre, why are you talking about this? I've been doing this my whole life. I want to make a practical point to you that's incredibly important, I think, when you're trying to resource homelessness in a broad, long-term perspective. So when you're looking at the federal funding that's used to impact homelessness in your community, it really comes down to a few buckets. The Department of Housing and Urban Development, HUD, and the Department of Veterans Affairs. I know, Andre, why are you putting that up there in some way that's equivalent to HUD? Because the amount of people who have been traditionally homeless and are veterans across America, and the amount of money that's been invested into communities and is available for your community on the VA side, it's just worthy of putting it up there because of the amount of resources available. So going back, if you look at the budget for 2018, 2019, and then you kind of look at this stepping back over a multi-year picture, here's what's incredibly important, COC leaders. Look at 2018. You had $2.5 billion, a lot of money, but not really. It's a very limited amount of money when you spread that out to COCs across America. $2.5 billion for the McKinney-Vento assistance grants that you're then able to apply for, and you apply for every year. HUD VASH thrown in there. So if you look at the budget for 2019, it actually went up a very, very small percentage, but it didn't go up much. If you look at the overall budget, same story. The Veterans Affairs budget, very static, a slight increase. And if you go back again, I'm not going to spend a lot of time on this, but this is what's important. And I want all of you to take this in the nicest way I can say this, but I really want to make an important point. It's a little bit, when we are looking to fund, first thing I want to tell you, when you're looking to fund how to help more people who are homeless in your community. You might be in a big community. We've got some very large cities on this webinar. You might be in a small rural community. Either way, as you're strategically planning over the next few years to look at these numbers to increase, the federal numbers to increase, for your NOFA numbers to increase, that is not probably a realistic solution for you. I've been at many national conferences with people that I love, and they step up on a stage and say, well, we'll end homelessness when we convince the president to up the budget by billions of dollars more than where it is now. Guys, we've been saying that from a national standpoint a long time, and I would just tell you, I support that, obviously, but that's probably not if you look at these numbers for 2019, 2018, and if you look at the numbers underneath the Obama administration, these numbers held pretty static comparatively, other than the VA funding numbers that really skyrocketed and now have plateaued. By the way, if you look at the amount of veterans in America who are now housed and no longer homeless, it's a straight line with the VA funding as it came into communities. So if we could increase these numbers, I think we would see a great impact on our local communities. I'm just telling you, if you're a betting person, that's probably not going to be where next year, the year after that, or in the next few years, you're going to be able to see more resources. So we'll send you this slide. I don't want to depress you. I don't want to start out by depressing you, but I will tell you these budgets and your pro rata share in your continuum of care through your NOFA process is probably at a plateau, a public policy plateau. And we'll send you all these and to make this happen. All good? Okay. So kind of stepping back from that a second, let's look at kind of 4 areas that you need to really, really look at when you are creating resources, and we're going to answer some questions on this. By the way, put a question in the toolbox if you have a question right now. Kind of 4 areas, stepping back, that you need to look at as you're doing your strategic planning for creating resources. Number 1, maximizing the engagement of your housing authority. So we're kind of back here to our big buckets of money. We were just kind of talking about the Department of Housing and Urban Development, HUD, their straight line to continuums of care, and I was again saying, don't get your hopes up. That money's probably not going to increase. But when you're looking at creating your big strategy on funding for your continuum of care, it's really, really important to look at the housing authority, the Department of Veterans Affairs, different because of how those are very fungible, if you will, based on how your community is implementing and working with those systems. So although it comes from the same bucket, housing authorities, the Department of Veterans Affairs are huge partnership opportunities. In my opinion, again, just speaking to you more frankly, this is a private webinar. There's no public consumption of this, just a continuum of care leaders. If you look at the allocation that you're getting down from HUD inside of the big budget that we have here, if you maximize these resources from HUD into your continuum of care, our data tells us you're only going to be able to reach about a 30% reduction of homelessness in your community, 20 to 30%, depending on the scope of your problem. For some of the bigger communities, it's even less than that. But this money is only going to get you so far. When we look at the communities, and we've studied probably 40, 50 communities over the past 24 months, 36 months, the communities that their continuum of care has figured out how to engage the housing authority, the Veterans Affairs Department, which I think has been highly successful, along with the overall high-level implementation of Housing First, which many of you have done well. Reason that's important is HUD said for years that they were going to cut you back, they were going to criticize your continuum of care, criticize, score you in a way that you could lose money. We've seen that happen. Whether or not you agree with that in your continuum of care, whether or not you've moved towards what we're saying here is legacy programs, transitional housing, versus the Housing First model, I will tell you, most of you out there, I think, have done this. If you haven't, I strongly urge you to look at how you are programmatically targeting the resources in your continuum of care, because you're gonna lose money. But you can't really gain much money by doing the best practice programs. So this is how you can make sure you're maintaining your continuum of care money. But these two, I think, are absolutely critical. This one, you know already. You're basing a lot of how you do supportive housing, rapid rehousing, etc. from this. So, poll question. My team says, let's do a quick poll question. Which of these four do you think your COC struggles with the most at the moment? Working with the housing authority, working with the VA, getting your community more towards the housing first model so you can make sure you're keeping all of your revenue, or possibly working with data and advocacy to get broader philanthropic contributions or even local money, city, county money. Sometimes it's not in the continuum of care process. It's not philanthropy, but it's certainly not something you're entitled to. So go ahead and answer that question right now. I'd love to hear what you're talking about, what you guys are talking about in front of your desks, because again, this is absolutely critical to being successful. We have the budgets. We have the actual budgets for probably some of the biggest cities in America. And when you look at Houston, Texas, I'm not sure if my friends from Houston, Texas are on. I'll just use Houston as one example because I'm a big fan of what they've done. Houston, Texas, if you look at their overall budget on homelessness and the reduction in homelessness they've had through a massive implementation of permanent supportive housing from 2012 to 2018, looking at their most recent data, the majority of the money has come from the housing authority when you look at the allocation of what it means. So, by the way, the early winner on our poll is data and advocacy, which is very, very interesting. Actually, I'm not questioning you out there, but I would tell you I'm going to dive into the housing authorities because I think that's a real critical area. So let's talk for a second about housing authorities. Housing authorities are a huge, huge undermined part of resourcing your solution on homelessness. Some of you out there, and by the way, if you're working really closely with your housing authority, I want to hear about it. I'd love for you, if you're a community that's working tightly with your housing authority and making big progress in partnership with your housing authority. I think we're going to do a webinar at some point and highlight some of you out there, so I'd like to hear your success stories. I'll tell you though, I see a real challenge with a lot of continuums of care not getting the partnership that is necessary to end homelessness. And here's really what that looks like. We're going to send you this, but I don't know if you guys have seen this out there. This is a letter that came out a few years ago from the United States Interagency Council on Homelessness, which is the official communication arm of 13 government agencies, including HUD, asking for housing authorities to create wait list preferences for those who who need permanent supportive housing and are in your coordinated system. Here is where the rubber meets the road, in my opinion, with you and your housing authority. If your housing authority is not working with you, and if there's not a straight line right here between the funding they get from HUD and your continuum of care NOFA money, and a straight line where the housing authority isn't then working with you to create a wait list preference, which means you go to your housing authority, right? And you say, hey, listen, I need vouchers for permanent supportive housing first. And they say to you, well, I can't give you a voucher. I got a waiting list of thousands of people who, for economic reasons, now qualify for a Section 8 voucher. Sorry, you're chronic homeless people. They got to get in line like everyone else. This letter, which we're going to send you 5 minutes after this webinar, says that they've been instructed to do, they haven't been mandated, but they've been instructed by USICH at HUD's request to do it differently, to establish a waitlist preference. So I'd love to hear from a lot of you. Have you gotten to a place where your waitlist preference has been established with your housing authority? And again, to use Houston, Texas as a great example, Houston, Texas was able to work with their housing authority, big city, some of you are smaller, I understand, but just put this in your own economy of scale. Houston, Texas, I believe in just 2015, got their housing authorities to delegate 2,300, I believe that's the number, and it's fluctuated, it's gone up year after year, 2,300 vouchers that were put in this wait list preference into their coordinated system that the Continuum of Care could use. So get your calculator out right now. Let's say that each of those vouchers, right, was worth $1,000 a month. Let's use some raw numbers. So that's $12,000 of rent subsidy paid per voucher. $12,000 a month, I'll have one of my team members do this. $12,000 a month times, $12,000 a year times 2,300. Matt on our team is doing the calculator. 12,000 times 2,300.
27.6.
That's $27 million a year towards the Continuum of Care's budget in rental subsidies that those vouchers from the housing authority represented. Guys, if you're running a Continuum of Care, and I know some of the dirty secrets you don't want to tell everyone out there. I know some of the biggest cities in America struggle with this because housing authorities, listen, I love housing authorities, and I appreciate the challenge they have. They're trying to solve poverty, affordable housing for half the country. I get it. But guys, we have to figure out how to use public policy, leadership to get them creating a preference so that we can put some of their resources commensurately into the Continuum of Care's budget. Big opportunity is going to be for your housing authority. If you have any questions on that, again, I'm going to send you this waitlist preference. I'm going to talk to you in just a minute because you're like, Andre, I've tried to work with the housing authority for years, and Sally at the housing authority won't take my call. I'm going to talk to you about how advocacy and data actually can be used also for housing authorities to help your housing authority move in the right direction. Let me just take a second. We've got some questions that have come in. Becky Schuler, from COC coordinator from Northwest Minnesota. Let me go back here. So chat box, if you have questions, you can put them in the chat box right now, or you can email them to us. But Becky Schuler, Northwest Minnesota COC, how can a COC develop resources for prevention work? And prevention, I'm assuming what you mean, Becky, by prevention there is, you've got permanent supportive housing that, you need a rental subsidy, you need the supportive services, rapid rehousing for those that you're not looking to give a long-term subsidy to. Some people consider that a little bit of prevention. But I would say this, the only way that you can systematically provide prevention dollars is to do two things. One, I know that a lot of you are not as much a fan of this, some of your communities. You really need to look at a progressive engagement model. This is a conversation that we need to have in communities because a progressive engagement model does two things. It helps, especially with those in poverty. We're seeing an increase in those who are coming to our Continuum of Care. They're coming to our shelters. They're presenting themselves in our coordinated system, but they're not chronic. But they're in need, but their need is more economically based. Okay, so a progressive engagement model is really the only logical way that you can then look at that person and say, where do we invest resources in as little as possible up front and as much as necessary to get them off the streets and, if possible, also get them to self-sufficiency. So a progressive engagement model is critical. And then one of the things you're going to constantly hear from me is a Continuum of Care has to raise money. You have to raise money outside philanthropic dollars, outside of your NOFA process, outside of your other processes. Some of you are like, oh, we can't do that. The community will never let us do that. Then partner with United Way. Partner with another agency in town to have that happen. But I will tell you, if you're going to do prevention, develop resources for prevention, you'll probably struggle to do that outside of a progressive engagement model because a community will understand what you're trying to do there that it's focused on people who need short-term intervention, and it's done in an educated way. Question 2, Natalie Martinez. How can a lead COC agency handle a lack of buy-in from both internal and external agencies? I'll get to that in a minute, but I would say money drives change, and influencers who are usually outside. I'm an advocate like you guys are advocates, but that's why we got to get a whole nother level of stakeholder involved. One more question, I'll get back here in a second. What are some of the ways to strengthen our COC to impact the community by reducing the increase of the homeless population? So what's interesting is if you look at all the data from around America, chronic homelessness is actually not increasing rapidly. That is not, if you look at all the data from across America, chronic homelessness is actually not increasing rapidly. And veterans homelessness is actually plummeted upwards of 80%, 90% in some of the most successful communities. 57%, I think, was the last number I saw nationally. So really, the increase you're seeing in your shelter system, and this is a great question, Mrs. Lewis, is how do we deal with what is an incredible, prolific increase of people who have economic challenges in a way that we really didn't see in our coordinated systems 10 years ago. That, and we're going to do another webinar on the second thing I'm about to talk about, the opioid crisis. The opioid crisis and our drug abuse crisis in America has in some ways overtaken in certain communities our continuums of care. You're seeing people who purely have a substance abuse disorder who now are pouring into our shelter system. Boy, and that's become, in record numbers, that's also become incredibly important. So something to consider there. So let me talk for a second about looking for new local resources. And somebody out there is like, thank God he's going to talk about how we're going to get some new money. So important conversation. So if you are looking at your planning, and not just, again, your short-term planning, but when you start talking about long-term planning in your continuum of care, I encourage you to create 3 buckets with you and your leaders. What's our strategy, number 1? How are we currently funding what we're doing? And then what are, in kind of category 2, what are some future funding opportunities? And this is the piece that you guys don't normally do that I'm really, really an advocate of seeing you do. Community engagement. A continuum of care, often, and I think you'll appreciate this, you're so busy. I mean, you got 100 things to do, running the coordinated system, pulling all the partners together, keeping the trains moving on homelessness all the time in your community. Andre, when do I have time to do community engagement? I'm just telling you, if you're here because you want to increase funding for your community's continuum of care, you got to start looking at doing this. Let me give you some examples of how you could do it. And again, this is interesting. I didn't think this would be the answer to the poll question, but this goes right into what you guys said was your biggest challenge, which was data and advocacy to drive philanthropic solutions. So let's talk about that a second. How can you get more money using data and advocacy? So I had some unique ability to work in Central Florida on homelessness. In my opinion, I know I'm biased, Central Florida is one of the most interesting stories on homelessness that I've ever come across, and I've been to cities across America. In 2013, Central Florida, Orlando, not just the city of Orlando, but Central Florida, 2.5 million, 3 million people. We were ranked number 1 in America for like-sized cities on chronic homelessness, and we ranked in the top 4 in every category that HUD measured. Not good. And it was a community that was one of the last adopters of housing first as a policy. So we were in a tough spot, and we were seeing homeless individuals everywhere. It was a huge problem, and we spent a bunch of years trying to arrest the problem away. We were in bad shape. Our community now, and I work around America, but this is a community I live in, 94% reduction in veterans homelessness, not 100%, but 94%, 54% overall reduction in street homelessness in just 4 years. How does that happen? Well, I can tell you this, it doesn't happen without money. It's impossible to move this forward without money. Actually, just write this down if you're taking notes right now. your ability to help someone who's homeless or help end homelessness in your community. It's not all about money, but you literally can't do it beyond a certain place without resources. It's not going to happen. It's not possible. So money is incredibly important. And let me talk a little bit about not just Orlando, but cities around America, what I've seen happen. They've done it different ways, but I've seen this happen. Number one, they brought leaders together. And again, some of you out there are like, oh my God, Andre, I got no time for this. Well, I'm telling you, if you are going to get new money, you got to get new leaders involved. Leaders who are not just in, government. But when I say government, often in a continuum of care, you're working with Paul and Rick and Sally, who are like, the homeless liaison for the county or the city's person on homelessness. But you're not really working with the mayor. You're not really working directly with the county commissioner, whatever you call it in your community. You got to get those people involved. And this is really part of what I've seen communities do successfully. But then you've also got to get people from other sectors, key sectors, because this is how you're going to start creating a bigger leadership conversation. My 2 cents, I don't want to take too much time on this, but getting business leaders involved is absolutely the most important thing you could do. Top business leaders. I'm actually going to skip ahead. I want to show you guys something because for those of you that don't have a lot of time, I'm going to come back to these. But if I had 4 pieces of advice to you right now that you could do, if you want to transform homelessness in your community and you want to get more resources, these are the 4 things you need to do right now. Now, by the way, if you're not doing housing first and you are still not working with your VA well and your housing authority isn't working closely with you, those are absolutely still on the table. But in this space, the 4 things you could do that are transformational to get new fungible money: build a business council. Get a group of business leaders together who now work in your continuum of care. Just so you know, some of you out there are like, Andre, I already got 2 business leaders on my continuum of care. I'm not. Don't put them in the continuum of care's board. Create a separate board. It could be a committee. It doesn't have to have any official authority. But you want to get a business leadership group that now is involved on homelessness because they can drive public policy. Your housing authority won't take your phone call or isn't able to meet your needs the way you think they should. Well, have the president of the big company call because he's now educated and he's working with your community at official level. So start a business council, create more of a public-facing messaging conversation, advocacy campaign. Create an impact fund. You got to have a way to raise philanthropic dollars. And so maybe you do that inside of your continuum of care. I have no problem with that. But you might want to do it through a United Way. You might want to do it through your community foundation. But a pot of money that is raised that you govern through your decisions at the continuum of care. And then again, big goals, advocacy, and the ending of homelessness that'll get people excited. So let me come back here a second. Let me come back to this, and so hopefully that's a little helpful in where I'm going. But let me say, in Orlando did a couple things that were really cool that got some pretty big resources that made a huge difference. Number one, Orlando did a cost study. By the way, we'll send this to everyone. Madison will put this in the link. This cost study, we'll email it to all of you. Greg Shin out of Tulsa was a big part of this cost study, so anyone in Oklahoma, Greg Shin, he's a rock star. But we studied the cost of chronic homelessness in Central Florida. We created a cohort in a year-long study, and it cost money. It cost us I think $80,000 or $90,000, which was a sacrifice. $80,000 or $90,000. Oh my gosh, Andre, you lost me right there. I could house 9 families in rapid rehousing with that money. Okay, I hear you, but watch this. We spent $80,000 or $90,000 on a cost study, which showed the cost of chronic homelessness was roughly $31,000 a person. We did this a couple years ago, probably 2014-15. And at the time, there were 1,577 chronically homeless individuals. So for the first time ever, our community was like, oh my gosh, it's like $500 million every 10 years to not house a handful of people, a handful of stakeholders. Boy, that changed our business community's perception of the problem, and we had already brought them all together. And let me show you what happened here. We painted the picture that you guys all know. These people aren't getting off the streets. They're in this cycle of homelessness. You know this. But then we showed them again what the Continuum of Care was able to do, and we got a lot of commitments. I just want to stress one to you. We got Florida Hospital to give which is the local Advent Health big hospital, to give a $6 million gift. I want to tell you guys this because I was a part of this. We didn't ask them for the money. They offered the money. They called us and said, hey, we want to help solve that chronic homeless problem. We now see this cycle that is happening. We now understand the cost of it and that there's a solution, permanent supportive housing. We want to help facilitate the cost of helping with the supportive services in a bridge while we build the system. So they put in $6 million towards that issue, but it really didn't come in a vacuum. It came by creating a leadership group that also then used data and a cost study with business leaders that made that happen. We used some of that money on a cohort of 100, where we then went back to them. We showed them a 57% decrease in the emergency room visits of those individuals, and it's fantastic. But again, you're doing this work, but how do we now do it with a group of people who are coordinated, especially in the business community? We'll send you all of this, but again, talking about advocacy and big goals. How can you get business leaders? Some of you have no money to invest in advocacy, but if you get a business council, you partner maybe with your United Way, partner with your foundation, your community foundation, you raise a little bit of money. Don't just go invest all that money into housing a couple more people. That's great. But the better use of, create a budget to be able to go out and turn public policy, getting your community on a pathway to really engage in homeless solutions together. This is a complicated slide, but I want to show it to you because I think it's important. So, normally the work you do, you get money from HUD, your VA, you got your tried and true leaders who work on homelessness every single day. What I'm saying is get some of your new leaders involved, and then that turns into money. But what you'll end up doing is having more people involved in strategy, accountability, and ultimately funding. If we want money, COC leaders, we have to bring top leaders into our process and educate them. Resources. Again, this presentation will be emailed to you. We've got a lot of resources that are available that we're going to send you. I want to answer a few more questions. We're looking for Amanda Wander from Tallahassee. Hi, Tallahassee. I'll be seeing you soon. I'll be up there soon. We're looking for resources on diversion and prevention processes. This is something that was asked earlier. I think you have to raise private dollars for diversion and prevention. There's some money available from SAMHSA. We can send you links on that. There's some state money that's going to be available for that. It's not adequate. Here's the way of thinking of it. Here's the best way of thinking of this. When you have a long-term need, when someone is in this cycle, when they're in this cycle and they have a long-term need, this person, chronic homelessness, they're not getting out of this cycle, you need a long-term subsidy, and you need thoughts towards long-term subsidies. When it comes to diversion and prevention, it's really not about long-term subsidies because we don't have that in any of our budgets. So you have to come up with more locally derived, short-term, sometimes city, county, and philanthropic resources. Raise money, and you can absolutely do that. And you can meet a lot of needs with $500,000, $1 million. Guadalupe Rodriguez out of El Centro, California. By the way, we do a lot of work in California. I pray for all of my friends in California. You have a huge challenge on your hands. I want to do a webinar at some point just for leaders in California because you guys have a mess on your hands. I think, by the way, Matt, let's send all of these COC leaders information on our mayor's webinar and our law enforcement webinars on homelessness. You might want to get your mayor involved in some of the, and his team involved, or your county commissioners involved in some of the webinars we're doing on homelessness. We coach mayors all the time on this issue. And I'll tell you, California, boy, you got a big challenge on your hands. But this was the question from Guadalupe. Do you foresee any funding for assisting homeless persons that have mental health issues and drug issues? So there's no specific, this is actually this chart right here. There's no specific money that's going to come in other than some SAMHSA funding that could be complementary for the drug part of this issue. But the mental health issues, this is, boy, we struggle with mental health funding in America. So I don't know that there's going to be new money. Let me tell you where communities, COC leaders, jot this down. When you're, keep an eye on the opioid settlements that are happening with big tobacco, with big pharma right now. Purdue Pharma just settled yesterday. Guys, there's going to be a massive windfall, billions of dollars, that in the next few years is going to make its way into communities through our states. A lot of the people, I think COCs need to make the case that we are seeing a lot of the opioid crisis at our front doors, in our shelter systems, presenting themselves in our coordinated system. A lot of them aren't chronic, though, they don't qualify necessarily for permanent supportive housing. So I think there might be an opportunity, Guadalupe, for opioid-specific related or drug abuse-related money in the next few years through the settlements that are coming down from Big Pharma. So keep an eye on that. Leonard Golden out of Atlantic County Government, Atlantic City. How is HMIS utilized to serve COC participants? Listen, you got to have good data. And if you don't have good data, you can't communicate to your coordinated care system. You can't coordinate to outsiders and prove that you're worthy. I'll just say this. If you're a COC and I'll give you a positive and a negative. The canary in the coal mine, there's a big city in America that I visited, and I got to tell you who it is, but they're not on this webinar. There's a big city in America that I visited 5 years ago who had a huge homeless problem, and you all know who they are. And I sat with the leader of their homeless work, and I asked this gentleman, hey, how many chronic homeless people do you have in your community? And this is his job, his full-time job, and he made a great salary doing it. And he said, I don't know. And I left that meeting with him knowing that community was in deep trouble, and they are today. The canary in the coal mine for me on a COC is your data. If you have good data, that doesn't necessarily mean you've solved the problem, but it means you frame the problem and you know how to tell the need to others. So that's a huge important factor. Using HMIS to utilize and serve your participants, but also tell the story of the need, the unmet need in your community. Andrew Shelby, Project Specialist, Community Planning and Advocacy Council from Camden, New Jersey. What's the best way to form a youth advisory board and to sustain it effectively against the work of youth homelessness? I want to come back and just tell you, if you are building a youth board, what you want to do is build it. Guys, COC leaders, everyone, pay attention for just a second. I want to encourage you with something. As much as business leaders and faith leaders and some of these other people that don't normally work with you are a pain in the ass, trust me, they are. When you're building these committees, a youth homeless committee, for example, don't just build it with the providers, because they're never, ever going to be able to build public policy. They're never going to be able to take your issue and drive it to where it has this pathway here, where you're bringing leaders down a pathway where you need leaders in your youth homelessness council, Andrew, that can set strategy in your community, create new accountability and funding, but that's going to be bigger leaders. Again, I have so many, I have such passion to see COCs adopt not just the housing first model and to do coordinated, your coordinated system well. These are all things and if you're not doing those, you're never going to be successful. But the next phase of the conversation with Continuums of Care is a few conversations about high-level work with your housing authority and high-level community engagement where you're raising philanthropic dollars and you are creating public policy that's going to expand your resources exponentially. There's no other way to expand resources other than doing that. Lisa Higginbotham, how do you partner with your local United Ways and specific to collective impact? So we do a ton of work with United Ways. Want to say hello out there to the United Way of Orange County, California, one of our partners. They just got, I want to say, a $4 million grant from the state of California for veterans homelessness a few weeks ago. Sue Parks, Bex from United Way of Orange County, California. Great job. Listen, and maybe we'll dive into this and send you a one-pager on this. Madison, we'll send them a one-pager on this afterward. But I will tell you, the United Way can be a tremendous partner. Let's say your Continuum of Care, Lisa, you're not saying this in your question, but it's possible that if you were to go out and you were to, as the COC, start raising money and doing advocacy, that some in your community would say that's not your place. United Way, I get that, but United Way can be a great partner. In my opinion, United Way and your community foundation and maybe your business chamber, oddly enough, can be three entities that could partner with you prolifically on the work of ending homelessness. What you would do, just getting super specific here, is you would have the United Way partner with you, put together a memorandum of agreement where you and the United Way create a business council basically together. And then the United Way would have to raise a little money to pay for a staff person or two, and they facilitate what is then a community campaign that you guys do together and an impact fund that you guys operate together. And they then have the ability to go into their network of business leaders, increase what they're doing, and partner with you to make big resources available for the Continuum of Care. I would say, though, that, and this is, let me go back to something, big goals. This is where a United Way, in partnership with you, they could say, we're going to go and end veteran homelessness. I know a lot of you are scared to put out those big goals because we've failed at those in the past or struggled. But big goals are always going to attract big leaders. Question, and we're not going to have a chance to get to all the questions, so we'll answer more of those questions afterward in follow-up emails. Can we discuss data and its impact on advocacy? Boy, this is a great question. This is from Leonard Golden. Leonard, you can't, great question. You cannot do advocacy effectively without good data. I'm going to go back to this because it's so important. We got, if you want some tangibles for this fall and going into 2020, think about putting together a business council, 20 to 30 business leaders with some faith leaders possibly, if that's your community's temperature. And you're going to get those people to start working together. Tell them 12 months. It's not forever. 12 months you want these people to get up to speed and help be a part of homelessness. You then, Leonard, would figure out how to take data in your community and use data to tell a story on homelessness that then gets people to see how homelessness has repetition to it, and then drive investments from that story. The advocacy is only going to be as good as the data that backs it up. So again, data, Leonard, and by the way, you can't do all the data at once. I would say every year, your Continuum of Care should be doing some kind of data report. And we have multiple data reports we've done before. We can send you guys this, and let you see the kind of reports that you want to do. We're going to be wrapping up in just a few minutes. Again, this presentation will be emailed to you soon. If you want more information on some of the work we do, you can go to leadhomelessness.org or email us. Our heart, my heart, is to see communities really help those in need. I want to tell you, Continuum of Care leaders out there, I think we're all, if we were being honest, I think we're all a little frustrated right now in as much as, we've been working on homelessness, a lot of you, for a long time, and I think it's reached a place now where we've seen some success in our communities. Housing First has worked. Housing First has made a huge difference. But now we're asking ourselves, there's still so many people on the streets. We're asking ourselves, where do we go from here? Lead Homelessness is all about how do we now look at the next iteration? How do we build off the success of what we've done in the past? And now, in a time when there's probably not, guys, COC leaders, listen, you're not going to get bailed out by the federal government on homelessness. You're not going to get bailed out. The budget to your ability to help homeless people in your community is not going to come from a massive increase in HUD's budget that comes down to the NOFA process. It's not going to happen. So if people's lives are on the line in your community, what are we going to do? In my opinion, that comes back to new ways of building upon the Housing First model, all the great coordinated systems, using data, using HMIS, targeting people with permanent supportive housing, rapid rehousing, working with veterans, working on youth homelessness. We know these things. But now, how are we going to engage our community in a way that's different than what Continuum of Cares have done before? That's the question, and that's what we want to help you with. One last question, and my team's telling me we have to go. One last question, but Hannah Mahorny, Hannah, I can't spell this, but advice for balance of states that cover large areas with multiple business and metro areas. So that's a great question. I would put together a statewide council. Statewide, so let's say you're in, I don't see what state she's in, but let's say you were in, Wyoming. Let's say you're in Wyoming. Wyoming would be a state with massive amounts of land, but very little cities that are spread out all over the place. You would want to put together, it's harder, but you'd want to put together a statewide business collaborative, get a few different United Ways, partner with your state government, and make that happen that way. But again, because you got to get top influential leaders involved or you're not going to have success. So we appreciate you coming on today. If you have other questions, email them to us. We work with a lot of you right now. We do these webinars often. If you're looking for help, if you're looking to help build your strategy, if you're needing help, putting together, all the different aspects of what you saw today, we can help you do that. So reach out to us if you have more questions. But again, last thing I'll tell you is I just want to encourage you. The work you do matters to people's lives. Our ability, when you can put this, I'll close with this. When we're talking about how do we create more resources for the Continuum of Care to end homelessness, ultimately what we're really saying is how do we get the money to help more people not be on the streets and change and save their lives. And you're doing that work every day. Congratulations to you for that. Thank you guys so much. We'll be back in touch with you soon. Email us any questions you have. See you very soon. Andre Bailey, Lead Homelessness Team. Thank you.